While assessing brachial artery flow mediated vasodilation, compression to induce ischemia is given: A. Proximal to the site of measurement in the arm, B. Distal to the site of measurement in the forearm, C. Either in the arm or in the forearm, D. None of the above. Correct answer C. Either in the arm or in the forearm. Usually, a segment of brachial artery is measured by ultrasound and proximal occlusion is applied for a period of 5 minutes followed by repeat measurements. Alternative method of induction of distal ischemia, the main vasodilatory stimulus, is by inflating the cuff in the forearm. Commonest great artery relationship in double outlet right ventricle is A. Normally related great arteries, B. Side by side aorta and pulmonary artery, C. Aorta is anterior and to the left of pulmonary artery, D. None of the above. Correct answer B. Side by side aorta and pulmonary artery. Side by side relation of great arteries with aorta to the right of the pulmonary artery is seen in about 2/3 of cases of DORV. Glagov phenomenon is A. Positive remodeling of the artery, B. Negative remodeling of the artery, C. Dissection of the intima of the artery, D. None of the above. Correct answer C. Positive remodeling of the artery. Glagov phenomenon is the positive remodeling of the arteries described by Glagov in 1987. Which of the following is an association of patent foramen ovale? A. Chiari network, B. Eustachian valve, C. Atrial septal aneurysm, D. All of the above. Correct answer D. All of the above. What is seen on this chest X-ray? A. Prosthetic aortic valve, B. Prosthetic pulmonary valve, C. Prosthetic mitral valve, D. Prosthetic tricuspid valve. Correct answer C. Prosthetic mitral valve. Prosthetic mitral valve, Starr-Edward prosthesis. Mitral position of the prosthesis is identified by the location below the line joining the left hilum and right cardiophrenic angle. The sewing ring is above and the cage pointing downwards and to the left. There are 4 struts for a mitral Starr-Edward prosthesis, while an aortic prosthesis has only 3. The position of the aortic prosthesis will be above the reference line mentioned above, and the cage will be pointing upwards. A double atrial shadow or shadow in shadow indicating left atrial enlargement is seen along the right heart border. At the same time, left atrial appendage shadow is not prominent on the left border, possibly indicating amputation of the left atrial appendage to reduce chance for clot formation. Sternal wires used for fixing the sternum after sternotomy are also seen. This X-ray is suggestive of A. Multivalvular heart disease, B. Pericardial effusion, C. Epstein's anomaly of tricuspid valve, D. None of the above. Correct answer B. Gross enlargement of cardiac outline due to pericardial effusion. In this case, there was underlying severe right ventricular endomyocardial fibrosis as well. Differential diagnosis of gross enlargement of cardiac size on X-ray include 1. Large pericardial effusion, 2. Epstein's anomaly of tricuspid valve, 3. Multivalvular heart disease, 4. Endomyocardial fibrosis. In large pericardial effusion, the shadow is globular with no lobulations. In valvular heart disease, different bulges in the cardiac contour will be seen due to asymmetric enlargement of various cardiac chambers. In Epstein's anomaly of tricuspid valve and endomyocardial fibrosis, it is mainly right atrial enlargement, including atrialized portion of right ventricle in Epstein's anomaly. Which of the following tests can be used for detection of right to left shunt across patent foramen ovale? A. Saline contrast echocardiography, B. Transcranial Doppler, C. Ear oximetry, D. All of the above. Correct answer D. All of the above. Saline contrast echocardiography using agitated saline is to detect right to left shunting across PFO. Transcranial Doppler can be used to detect microbubbles in the middle cerebral artery after injection of agitated saline into the peripheral vein. Ear oximetry can detect fluctuations in oxygen saturation due to right to left shunt across the PFO. Which of the following is not a diagnostic test for carcinoid syndrome? A. 24-hour urine 5-HIAA, B. 24-hour urine VMA, C. Chromogranin A, D. Indium 111 penditriotide scanning. Correct answer B. 24-hour urine VMA. Urine VMA estimation is done for the diagnosis of pheochromocytomas. 5-HIAA and chromogranin A are used for the diagnosis of carcinoid syndrome, while 111 indium penditriotide scanning is used in locating the tumor as well. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.